Hello. This presentation will be providing a deeper dive into the MBQIP measure, Safe Use of Opioids-Concurrent Prescribing. My name is Nicole Freeman, and I will be presenting with my colleague, Ann Logus. Our objectives are to help you have a better understanding about the measure requirements in order to report the Safe Use of Opioids measure, and then identify the steps for success to reporting this measure through the HQR system. Now I'll pass it over to Ann to discuss our engagement activity.
Thank you, Nicole. During this presentation, we highly recommend that you participate in a mini engagement activity. As you listen to the presentation, please watch for 7 slides with activity stops marked with a red stop sign. Nicole will also notify and remind you of the activity as she is presenting. These 7 activity stops describe a key step in the collection and reporting of this measure. Because successful submission requires several team members with different skill sets, such as clinical, IT, EHR, and quality skill sets, it is extremely helpful for teams to clearly identify who is responsible for the different steps of the process. It is important to note that there are more than 7 steps, but for the purposes of this activity, we have prioritized 7 of the most significant steps. So when the slides are presented, please write down who would be responsible for that step at your facility. Who could be a person, vendor, department, someone inside or outside your facility. It could be you, or maybe you don't know. We will discuss your results at the end of the presentation. Nicole?
This slide introduces our Arquita team. We are excited to be serving you in all of your quality reporting efforts. This slide provides a quick visual of the 2025 MBQIP core measure set. As you can see, the safe use of opioids is a core measure under the patient safety domain and reported annually. As a reminder, for calendar year 2025, the deadline to submit 4 quarters worth of data is Monday, March 2nd, 2026 by 11:59 p.m. Pacific Time. Now we'll jump into more of the measure details. The Safe Use of Opioids Concurrent Prescribing ECQM is commonly referred to as a short name of Safe Use of Opioids. This measure is a quality measure that was adopted for use in MBQIP by the Federal Office of Rural Health Policy beginning with the 2025 calendar year. This measure looks at the proportion of inpatient hospitalizations for patients 18 years or older prescribed or continued on 2 or more opioids or an opioid and benzodiazepine concurrently at discharge. The ECQM ID is CMS 506 version 7, which will be important to note when reviewing the ECQM resources, as this ID number is how CMS references this measure within their documents. As I mentioned, this measure is part of the patient safety domain for MBQIP and is also available for reporting in other CMS quality programs, including the Promoting Interoperability Program and the Hospital Inpatient Quality Reporting, or IQR program. So why is this measure important to report, especially as a critical access hospital? Unintentional opioid overdose fatalities have become an epidemic and a major public health crisis in the United States. Opioid use disorder has a disproportionate effect on rural communities with respect to prescribing, overdose, and mortality. Patients who have multiple opioid prescriptions have an increased risk for overdose, and the rates of fatal overdose are 10 times higher in patients who are co-dispensed opioid and benzodiazepines than opioids alone. By eliminating the concurrent use of opioids and benzodiazepines, this could reduce the risk of emergency room and inpatient visits related to opioid overdose by 15%, and reduce preventative mortality and costs associated with adverse events. It is also providing meaningful data for quality teams to develop and initiate interventions in order to improve health outcomes. Now let's talk about some steps for success that you and your hospital can take to capture and report this measure. Reporting data for a new quality measure for the first time can be a daunting task for hospital staff. These are some first steps hospital quality teams can take for reporting this measure. You should start by reviewing and understanding the measure criteria to identify the target population, submission deadlines, and reporting system. Next, start to access your patient data using your EHR system or other hospital databases to ensure you have access to relevant and discernible data fields required for this measure calculation, and determine whether your EHR system meets the certified technology standards required to report. Once you have access to your patient data and determined whether you have certified electronic health technology, you'll work to incorporate the criteria for identifying patients by setting filters within the EHR system and clinical workflows to capture the eligible population. Finally, you'll need to extract data for eligible patients by utilizing reporting tools or queries within your EHR system to generate a QRDA1 files for submission. On the next few slides, we'll walk through each step in a little more detail. Each year, it's important to review the measure specification as updates may take place that impact the way your EHR currently captures patient data. These updates will ensure that you're capturing the correct target population and specific patient demographics, diagnoses, procedures, and other clinical characteristics. This measure data is collected for a calendar year, January 1st through December 31st. It is submitted annually with data being due on February 28th, and if the February 28th deadline falls on a federal holiday or weekend, it will default to the first business day thereafter. For calendar year 2025, March 2nd will be the submission deadline. This measure is reported through the Hospital Quality Reporting, or HQR, secure portal under the ECQM tab as a combination of a QRDA Category 1 file, zero denominator declarations, and/or a case threshold exemption. For example, less than 5 patient cases in the reporting quarter. Stop. This is our first activity question. Who would oversee measure preparation at your facility? As part of your ECQM requirements, CMS requires the use of Certified Electronic Health Record Technology, or CERT. To determine if your system is certified, you'll need to reach out to your Health IT department to determine the certification ID number. Or you can visit the Certified Health IT Product List, or CHAPL website, and search for your specific EHR system products. I will quickly walk through how to search the site on the following slide. Activity stop number 2. Who would oversee verifying your EHR certification at your facility? After navigating to the CHAPL website, you can search for your EHR developer, for example, Epic, Cerner, Athena Health, etc., and select each product or service that your EHR includes. This may require some assistance from your Health IT department or vendor. Once you find the developer, you can select CERT ID and begin to select the products. Once you have selected your EHR products to meet the certification criteria, a pop-up will indicate that your certification ID is ready to create. Select Create Certification ID, and it will populate an CMS EHR CERT ID as shown in the screenshot on the right. As a reminder, the CMS CERT ID is required to submit data in the HQR secure portal. Once you have identified whether your EHR is certified, you'll need to dive into the criteria for capturing eligible patients and quality actions within the target population. For safe use of opioids, the measure population, also the denominator for this measure, will include all inpatient hospitalizations that end during the measurement period, where the patient is 18 years and older at the start of the encounter and prescribed one or more new or continuing opioid or benzodiazepines at discharge. It is important to note that there is no sampling for this measure. Hospitals will need to report all cases that apply to this population criteria. This screenshot depicts a decision chart that can be used for implementation in your EHR's workflow, and also provides a great resource when trying to determine if a patient meets each criteria of the measure step by step. After determining the denominator, the next step is identifying any patient exclusions. Exclusions include patients with cancer pain that begins prior to or during the encounter or are ordered, or receiving palliative or hospice care, including comfort measures, terminal care, or dying care during the hospitalization, or in an emergency room encounter for observation stay immediately before the hospitalization. Also, patients receiving medication for opioid use disorder, sickle cell disease patients, patients discharged to another inpatient facility or left against medical advice. Discharge to another inpatient care facility includes community hospitals, tertiary referral hospitals, and acute care hospitals, but does not include long-term care and acute rehab facilities, or patients who expire during the inpatient stay. After we identify the denominator, the decision flow proceeds to denominator exclusions. Any patients that meet one or more of these exclusion criteria will be excluded from the measure calculation. Finally, you'll identify the patients that qualify for the numerator or the quality action. The numerator includes all inpatient hospitalizations where the patient is prescribed or continuing to take 2 or more opioids or an opioid and benzodiazepine at discharge. As you can see in this visual, patients can meet the numerator through 2 different scenarios. One is encounters of patients prescribed 2 or more opioids, or an opioid and a benzodiazepine. After all of the eligible patients and their clinical actions have been captured, the data is ready to be extracted into a QRDA-1 file. Activity Stop 3. Who would oversee the facilitation of clinical workflow updates to capture the population criteria, or the data entry into the EHR at your facility? After you've identified all of the measure criteria needed to appropriately capture the measured data, you can work with your EHR vendor or health IT department to help export the QRDA-1 files from your system for reporting. In this screenshot, you'll see the list of quality data elements for the safe use of opioid ECQM that will be extracted from your EHR. Now that you have your QRDA-1 files, let's walk through how to report. Activity Stop 4. Who would oversee the extraction of the data after the clinical actions have been complete? Now that you have captured your data, let's talk about what you'll need to do to report for your hospital's hard work. In similar fashion, we've identified steps for success to report the safe use of opioids measure. You'll begin preparations in Q1 of the calendar year to report. It's important to create and/or check your hospital quality reporting HQR access before the submission deadline to ensure that you don't hit any issues when it comes time to submit in early 2026. Once the submission period opens, you'll need to upload your QRDA-1 files to the HQR system and/or complete your zero denominator or case threshold exemption declarations. Finally, don't forget to verify and generate your submission report and retain a copy for your records. Let's go through a few more important steps within these areas. It's very important that if your hospital submits this measure for the PI program, MBQIP will receive credit from that submission. There is nothing additional you need to do for MBQIP if you're already submitting this data for the PI program. FMT will be able to access the data and include this in your MBQIP reports. If you're not sure if your hospital is participating in the PI program and submitted this measure, you can look at your MBQIP reports to find out. This may eliminate the need for duplicative work. Otherwise, you'll need to prepare for reporting by confirming your Health IT EHR is certified via the Chapel website that we walked through earlier. We don't recommend waiting until you're ready to report to verify and generate your CERT ID, as this is a requirement needed to report. It's important to verify early that your system meets the certification requirements. Then, you'll need to confirm your QRDA1 files are constructed to meet the most current calendar year 25 requirements. This information can be verified by your Health IT vendor or Health IT department when you export your QRDA1 files. Activity Stop 5. Who monitors what quality programs your facility currently reports? Does your facility currently participate in the CMS Promoting Interoperability program? If you're not sure, who would you ask? After you export your QRDA1 files, you'll need to log in to the HQR system. Navigate to your hospital's dashboard menu and click Data Submissions. Under ECQM, you'll be able to click File Upload, and you can select a submission type between Test or Production. Test should only be used to make sure the file type and data is in an acceptable format. Any data that's submitted under Test will not be counted towards your submission. Please be mindful which submission type you select when you're ready to submit. We recommend doing a test for at least one QRDA1 file to determine if it contains any issues before submitting under production. Once you have tested your QRDA1 file, you can begin submitting your files under production. Once the files load and the HQR system processes them, you'll receive a confirmation email to the address associated with your HQR login. After you receive confirmation, you can review the processing status by navigating to the Data Results section of the left-hand navigation bar and click ECQM under the Files tab. Under Program, you'll need to click IQR/PI and Submission Type of Production. Here, you'll be able to download any errors in your files. Then you can navigate to the Accuracy tab next to Files, and this will be how you locate any rejected files for revision and resubmission. Under this tab, you'll see the counts for the total number of files that were accepted, rejected, and deleted. If you qualify for the zero denominator or case threshold declarations, those can be attested to under the ECQM tab under Data Form. Launch the data form, select the quarter that you want to declare, enter your declarations, either 0 or the number of cases less than 5, then click I'm ready to submit. It's important to remember to complete these declarations for all 4 quarters to successfully submit. Activity Stop 6. We're almost there. Who would oversee reporting your ECQM data to the HQR Secure Portal? Do you know if they have the correct accesses to successfully report when it's time? Once you have submitted all of your data, it's good practice to verify your submission and generate a program report for your own records. Under Program Reporting, select Program Credit. Select the program that you reported for, in this case, PI, and each quarter. The report will show which measures were submitted, the status, and date of the submission. If a green banner appears, this indicates a successful submission was achieved. However, a yellow banner will appear if issues still occur and a successful submission was not achieved. Final activity stop. Who would oversee the verification of your submission? I'm now going to pass it over to Anne to facilitate our engagement activity discussion.
So how did you do with the mini engagement activity? Were you able to determine who is responsible for the 7 steps discussed at the activity stops? We encourage you to use the information you gathered and share this slide deck and the resources included with those individuals. Make sure you have their contact information and also make sure you share their contact information with all involved. Maybe you need to have a group meeting. Help them to see the big picture in reporting this measure, along with the individual steps they are responsible for. Connect with other critical access hospitals to learn their approach to reporting this measure. Use what you have learned about who is responsible for the steps and leave this presentation in action. Set a goal to ensure that all involved clearly understand the steps they are responsible for and that they have access and understand the tools and resources available to successfully and accurately report this measure.
We've provided you some great resources and tools to get started collection and reporting of this measure. We've classified each resource into a similar step order to the slides depending on which areas you identified as needing more assistance. If you plan to work with your vendor for reporting the ECQM, it's important to be aware of these resources and share with your vendor as well. And this slide provides you with more resources on reporting the measure. We also wanted to highlight a few ARKITA resources to be aware of. We have the updated 2025 MBQIP Measure Core Set Information Guide that includes details on the core MBQIP measures, the monthly MBQIP reporting deadlines document, and the Safe Use of Opioids Data Submission Guide. All are available on the Telegen ARKITA website. This concludes our presentation today. If you have any additional questions on the Safe Use of Opioids measure, please reach out to our ARKITA team at the email arkita@telegen.com. Thank you.